you for staying with us. For those of you joining us, this is KTN Weekend Prime. Now, when you think of a hospital bill, what comes to mind? Is it whether you can meet it, or if paying that bill will leave you worse off and staring at poverty? Well, Gloria, Antonina and Benson are three parents who spoke to Dr. Korir on how the hospital bills have left them with little option but to appeal for help if the loved ones are to bounce back to good health. Here is this week's Health Digest that is looking at the cost of health in Kenya.
Access to basic health care is still a major challenge to many Kenyans, especially the poor and low-income earners. Very few Kenyans are members of a contributory medical scheme like the NHIF or a private medical insurer. As a result, in case of a medical emergency, many will resort to family, friends, and other well-wishers to fundraise in order to meet a medical bill and meet in part or in full the financial costs that come with a medical emergency. Casey is a few months shy of 3 years of age. His mother, Gloria, has to brave his recent cancer diagnosis on his behalf.
At that point, I actually thought that was a death sentence. Since 1 year old.
That's when you had it diagnosed?
Yeah.
Camille Anan is 10, a star footballer in his school, but sickle cell disease has almost held him hostage.
I don't sleep well.
He's undergone 4 surgeries, and he's been referred to Israel.
Gloria and Antonina's struggles are shared by Benson Ondijo, whose wife is fighting for her life in a hospital after a complicated pregnancy. She suffered a thyroid-related emergency that landed her in the intensive care unit, ICU.
My biggest wish would be the mother to meet the baby. That to me is the most difficult thing to comprehend.
All these three families have one thing in common. The medical costs incurred so far is pushing them to the brink of bankruptcy.
I won't deny it is very expensive. The first bill we were paid for by our insurance. It was about 600,000 thereabout, and we were in hospital for only 2 weeks, the first admission. The second time we went to hospital now, we had to pay out of pocket.
The bill cannot be... At some point it was growing at 200,000 a day.
I've not gone to work for the last 4 months. I closed up my office, brought everything in the house. I can only do 1, 2 things from the house.
Like other families appealing for medical help through various platforms, including social media, it does not always yield results.
All Kenyans, everyone has a problem. So, mtu atawacha shida yake akusaidie, because how many people will you help? Everyone has a pay bill number for whatever it is. Everyone, whether ni harusi ama matanga.
I also have...
Out-of-pocket expenditure for health is estimated to be above 60 billion shillings, with almost 50 billion spent in outpatient services.
This is the only industry that I know where the center of operation is not the customer. We work to a health system, and each department you have to register, and you are treated there. If you need an additional service, you need to register in the next division, and you have to navigate the health system alone.
The huge gap between the public and the private health sectors is obvious.
In the private sector, the greatest motivation why people go into private is a profit motivation.
NHIF will not pay everything for everything, no.
To avoid catastrophic health spending, which is basically healthcare bills that are so high compared to a household's budget that it disrupts the living standards, the business model of the Kenyan health system must be addressed, and it has to be addressed fast. Dr. Korir for Health Digest, KTN News.